Dr. Vaughan, that's what we call it when we periscope. Let me go ahead and turn the camera around so I can see you guys and I can see what you talk about medicine together, medical topics. Briley, 129, thanks for joining us. We're glad that you're here. West Coast, Howler 5-pack, Dix 5, Sarah Nicole, Shannon Krutz, thank you all for joining us. We're glad to have you here on this session of Ask Dr. Vaughan. I noticed that a lot of our participants, a lot of you guys have names I don't recognize. Some of them went by so quickly I wasn't able to make them out. And this is, oh, hello Shannon, thank you for joining us. Thank you for the hearts. We're available for, at this point, nobody's asked any questions, so we can entertain the first question that comes up and take others as they come along. Hello, hi Mary, thank you for joining us. We're glad to have you here. I can talk a little bit about how the morning went. Oh, don't forget, thanks for joining us. And hi at DLL 3000. We're glad to have you here too. And Buttermilk 1995, thank you also for joining us. This morning I tried to get a patient to let us do a procedure on Periscope, but the patient didn't want to. It was going to be, well, it was a shave biopsy and some cryotherapy on some lesions on the head. How much vitamin D3 should I be taking? Vitamin D3, if a person is making their own in adequate amounts, they don't need to supplement at all. When we do supplement vitamin D3, oftentimes we'll do it at around 1,200 international units a day. A lot of times it'll come in, actually combined with calcium, and each tablet will have about 400 international units, and we'll have people take maybe 3 of those. Although we're trying to cut back on the calcium, supplemental calcium we're giving patients, because it seems like we're having some problems with that, possibly some risk for heart disease, and we know that it does contribute to the development of kidney stones. So it's nice to not get too much calcium. If you're just getting vitamin D by itself, a lot of times we'll use a 1,000 unit dose once daily, and that's a good, for people, unless they have a serious deficiency, then they need more. Somebody wanted to repeat that. It's around 1,000 to 1,200 international units daily if you're supplementing vitamin D3. A lot of times people get even more. In fact, we can dose sometimes up to 10,000 units daily. Somebody who's new has asked what kind of doctor I am. I'm a family practice doctor here in Auburn, California, the Auburn Medical Group. Somebody has an underactive thyroid. Really, the only thing you can do for that is get some thyroid hormone. There's different forms of it. We no longer recommend the natural thyroid because it comes from animal sources that aren't consistent from batch to batch. The Armour thyroid is no longer recommended by the FDA, so now we recommend synthetic thyroids that do a great job. Are you for or against diet soda? I am against diet soda. I'm against regular soda. I will occasionally have a root beer. I will occasionally have a diet Mountain Dew when I'm driving, you know, to help keep awake. But for the most part, I recommend people drink water for hydration and not getting your calories through water, nor using diet sodas. Although there is a sweetener in diet drinks that I do think is all right, and that's sucralose. Do you recommend antacids with warfarin? Actually, not routinely, no. If I think I have, can I get everything over the, I think you're talking about balanitis and over-the-counter for that. If it clears up with an over-the-counter antifungal, great, or just simply washing twice daily. But if it doesn't clear right up within a week's time, get it checked by a doctor, because you can have very bad things. And what they're referring to is an infection under foreskin on a man who's not been, or male who's not been circumcised. Renee Marie, thank you for joining us. We're glad to have you on Ask Dr. Vaughan. New development. Over the weekend, I made a new website called AskDrVaughan.com. Some of you may have been there when I was working on it and looked at it. Please, it's very early in its development. Please write to me with suggestions or comments so I can make it better. Okay, somebody who's circumcised can't get balanitis. It would be something else. Maybe even cellulitis. That absolutely should be evaluated by a doctor. Am I a pediatrician? No, Rena Marie, I am not a pediatrician. I'm a family medicine doctor, although I take care of kids. Trained in emergency medicine in all age groups, including children. Christy Scope, thank you for joining us. Miss Kimberly Ann, thank you for joining us. We're glad to have you here also. I see a lot of new names. It may be that we've got so many followers, I'm not as familiar with all the people who have been up. And that's great. Thank you. We're glad you're here. If you're not, please do slide right and follow if you haven't already. Hey, Christy Scope. Fox Media, thank you for coming on. And I do believe I've seen that name before in the past, in previous Periscopes. The Inred, thank you for joining us. What job do I have? I have the best job in the world. I get to be a doctor to my patients, practicing family medicine. Somebody loves my mustache, thank you. And you're welcome. Gaining popular, I guess so. Thank you, Married DX5. Is too much iced tea no good, unsweetened? What is the best health food? Yeah, too much tea, you can get too much caffeine stimulation. Oh, thank you for asking about my mom, Fox Media. She is doing great. I saw her this weekend, and she was doing very well. Actually, it was my dad I had to check on this weekend, and he had the same thing she did with the dizziness. And once we got rid of just the symptom controlled, he was fine. And they didn't give me a call. I haven't talked to him since Sunday or Saturday, but he was fine then. Told him to call me if he didn't continue to do well. Capizzi25, thanks for joining us. Hey, Lawful. Joshua, thank you for joining us. Good news. Oh my. Hope they have to. Yeah, he's getting better. Thank you though. Holly Dolly brought me here. Thank you, Holly, for. Oh, and I do need to thank. And hey, Capiz, I need to thank Holly Weiss for her nice tweet that was telling all of her friends to check us out on Periscope, along with 4 others that she likes to follow on Periscope. Do you have any patients with chronic fatigue syndrome? In the past, I have one who's had it. He's gotten over it, actually. How do you pronounce your name, bro? Vaughan. It's a single syllable, V-O-N. The Welsh have this thing about wanting to put in way too many letters in words. So, yeah, just all these letters that don't add anything to the pronunciation of a word. And so Vaughan, if it was V-O-N, it'd be pronounced the exact same as V-A-U-G-H-A-N. Thoughts on degenerative disc disease? When I think of degenerative disc disease, I think of something that comes more so with genetic predilection rather than anything you did to it. The arthritis of just degenerative disease in the spine or joints does get worse as you get older, and so people will call it wear and tear arthritis, which there's a certain component of that to it, but really it is your genes that give it to you more so than anything. Best treated with pain relievers like ibuprofen or nonsteroidal anti-inflammatory drugs. Seems to respond better to those than Tylenol, even though I prefer to use Tylenol for pain relief. But if it's not working as well as the anti-inflammatories, then they would be the better thing. The problem with the anti-inflammatories is that they're hard on the stomach and the kidneys. You need to take them with food and water. For asking, I'm curious too. Oh, you're asking about the degenerative disc disease, I'm hoping, since that's what I'm talking about. So we do have a lot of people who take the regular ibuprofen or other anti-inflammatory medicines. You need to get your kidney function checked regularly if you're taking it. You do need to have regular contact with your doctor if you're on a medicine like that on a regular basis. Other medicines that can be used include, well, anything that treats pain. We're trying to get away from the opiate or narcotic pain medicines and get to things like tramadol that can be used more freely. Want to know we can send private questions? No, for stuff that you want to have remain private, that would be reserved for somebody I have a doctor-patient relationship. We do that through the Auburn Medical Group. How long does pneumonia vaccine last? If you're over 65 when you get it, it's supposed to last for as long as you're able to live. For people who get it before age 65, we recommend repeating it at one time at 5 years. And for people with severe problems with immune dysfunction, they'll actually get it renewed more often than that. Hey, Holly, I was thanking you earlier. I don't know if you heard. I was thanking you for that tweet you sent out telling everybody to check out us on Periscope along with those 4 others that you like to follow. So thank you very much, Holly. We like it when you guys share us with your friends. And lots of hearts there. I'm impressed. You guys are very generous with hearts. Thank you. Oh, you did? And I miss it. I'm sorry. I'll have to catch it. And since replays last for 24 hours on Periscope, I should be able to catch it. They also last even longer for some of the Ask Dr. Vaughan and some of the procedures we do because I put them on my YouTube channel, and then you can find them at AskDrVaughan.com. Some of you may have seen that. For those of you just joining us, this is Ask Dr. Vaughan, where you get to ask a family doctor questions that you would love to ask a doctor if you had one available. It's for people who don't have a family member or friend who's a doctor. My weekend was awesome. Thank you for asking, Holly. How was yours? And Jamie Folstad, live in Midwest, allergy relief. Allergies. We can touch on allergies real quick here. A lot of people will do allergy testing. What we find with allergy testing is people are told to get rid of their favorite pet and not allow it in the house, or they're told to put plastic bags over their pillows and mattresses. And if that's what you're told to do and you're able to do it and get relief, great. A lot of people just find that's asking too much for them to be compliant with those requests. Get rid of their favorite pet or whatever. Also, oftentimes they're not told that they're allergic to things they know they're allergic to on the allergy testing. So I'm not big on the allergy testing, but rather going the next step, which is what they do when you're not able to get success with the treatment based on the allergy testing, and that is go to just for nasal allergies, a steroid nasal spray like Flonase or Nasonex, which is over the counter now. Be sure to use it correctly if you're using those. And I do recommend you do it under your doctor's supervision so that they can follow what's going on, make sure something worse isn't going on. Those medicines can cause side effects. I actually am one of the people who can't take them, even though I recommend them first line. And then after that, I recommend over-the-counter Claritin because it's inexpensive. And if that doesn't work for you, I recommend trying Allegra. And then if you're still not getting relief, I recommend checking with your doctor. I follow whenever I can. Yes, Holly is great. Sorry, I was speaking while some of you guys were talking there. I may have missed some. What about food allergies? Does it normally have 2 pages worth of food allergies? My weekend was crappy. I haven't been sleeping. Oh, I'm sorry, Holly. And you're welcome, Jamie. 2 pages of food allergies. Wow. Oh, man. Now, probably what you'll find is some of those are real and some of those are kind of soft as far as how you're affected by those foods. The problem is to go testing them. You could get yourself in big trouble if you have a anaphylactic reaction to one of them. So you have to be guided through that through your allergist or whoever ordered the allergy testing. And vertigo and thanks and gluten intolerance and Holly is pretty and anything else? Gluten intolerance. Gluten intolerance is, well, there's an actual condition called celiac sprue, which it looks like is more common than we used to think it was because a lot of people will get rid of a lot of symptoms, especially GI symptoms, problems with digestion, with stopping gluten in the diet, which is in wheat. They don't have what it takes to break it down properly. Rather than, well, there's also people with a true allergy to it. The people who really have a true intolerance and not just a sensitivity, they need to not only not have it in the diet, but have the food preparing area and utensils not come in contact with gluten-containing foods that are used in their food, because they can actually have a reaction from very small exposure to it. And the way to find out if you are is whatever symptoms you're having, if they're regular, and that's one thing they have to be is regular, you stop all exposure to gluten strictly for at least 3 weeks. And if your symptoms totally go away and then with reintroducing gluten into your diet, they come back, you know that gluten is the problem. There are tests that also will test for gluten intolerance or celiac sprue, and the tests don't tell you the same thing that the real-life trial tells you, and so that's why I like to go with the real-life trial rather than just a blood test. Autistic people can't have gluten. I've not heard that. Relief for vertigo, it depends on what's causing the vertigo. Can be caused by very serious things. Stroke, for example. Seizure, not as likely. Cancer. Very, very serious things can cause vertigo. In addition to completely non-serious things that we call benign. A common condition called benign paroxysmal positional vertigo is very commonly seen. In fact, you probably see it in the doctor's office once every couple of weeks. Hello, Dr. Vaughan.
Hello.
And that's something that's treated with some maneuvers that you can find online, the Epley maneuver or CMOT maneuvers. But it really should get checked by a doctor. Knees start to hurt if I stand too long or sit for about 10 minutes. Why is that? And you're pretty awesome. You guys are pretty awesome. Knees hurting with standing, it can be from any number of things. We'd go into details about where it's hurting and do an evaluation in the office of the knee physical examination to try to find out if this is a problem inside the joint or a ligamentous problem or a muscular problem or even a low back problem with pain radiating, referred pain down to the knees, or even possibly a vascular problem, but unlikely because of vessels not letting enough blood through. Big Red Lunchbox, thank you for joining us. We are glad to have you be a part of Ask Dr. Vaughan this afternoon. Upper back pain. Now, upper back pain is more concerning than lower back pain because it's not as often, and we get more concerned about bad things causing it rather than just sore muscles, which oftentimes happen. CT scans can be dangerous. I think there was a question about how many CT scans. There is an actual number that has been thrown out in the emergency medicine literature, although I don't know that it's supported by the radiology or radiologist literature. And the example was in a trauma activation in a trauma center, a patient who is unconscious and been through a significant trauma will have sometimes CAT scan of the head, chest, and abdomen, and then have a contrasted CT of the abdomen, meaning a contrast is either in the GI tract by mouth or through the veins, and so they'll have a scan again with the contrast to compare it against when they had the non-contrast scan to find abnormalities. I did hear once an estimate that 6 or 7 of those procedures of doing that full workup on a person for a trauma, that it takes 6 or 7 to know that you're pretty sure that you caused cancer in one person. Now that's because there's several scans going on, not just one, but several of the abdomen, chest and abdomen together usually, and you get one of the head, and there's a lot of scanning going on, head, chest, and abdomen. So you can see that we probably want to keep the number of CAT scans a person gets to an absolute minimum of what's needed. So I'm not getting a person a CAT scan unless I'm thinking it's going to find something or rule something out that really needs to be ruled out. MRIs were a lot more free to get, even though they're more expensive, and they don't always show the same information. For example, MRI really doesn't help you with skull fractures or facial fractures, but it can help with looking for abnormalities in the brain. Somebody had a hypoglycemic seizure, A1C chest, no diabetes. Is it important to get an MRI now? Hypoglycemic seizure. Well, we wouldn't be all that worried about your A1C, and the reason is because people with diabetes mellitus or sugar diabetes do not get low blood sugar. The problem is that they don't control their blood sugar from going too high. Diabetics will often get low blood sugar readings from the treatment of sugar diabetes, but sugar diabetes itself is not the cause of the low blood sugar. It's the medicine they take for it. So if you don't have a diagnosis of diabetes and you're having low blood sugars, it's not diabetes. To have a seizure from it, you need to get checked for things that can really knock the sugar down, like a glucagonoma, a cancer that can cause inappropriate secretion of insulin. Emily Hazard, thank you for joining us. What do you think about that? Insulinoma. I'm sorry. Insulinoma. Glucagonoma. Is there such a thing as a glucagonoma? There probably is, yeah. It'd do the opposite. It would cause you to have high blood sugar. Thank you for correcting me there, Dr. Vaughan. Dr. Brady. Have you guys seen Dr. Brady? Let's take a look at Dr. Brady over here. And all the people who don't know us don't know that, that you're the other Dr. Vaughan.
Inside jokes.
Inside. 40 hours of not eating a lot while flying. Yeah, that should not happen. Something is wrong. Maybe not a cancer, but something is wrong for blood sugar to be able to get that low that you had a seizure, because people can go faster without seizures all the time. It may be that you're the unique individual who really needs to have sugar supported, but that needs to be worked up. Insulinoma, you said, to get tested. Yes, I'm sorry. Dr. Gwen Vaughan corrected me. Insulinoma, a type of cancer that can be in the pancreas that can produce insulin inappropriately, can cause people's blood sugar to go down. And it's not something that's easy to recover from. This would not be a single event causing a low blood sugar and then you had a seizure. You'd be having an ongoing problem with not being able to maintain adequate blood sugar. You'd get sick very quick, I would think. What about you, Dr. Gwen? If somebody had an insulinoma, they would be continually getting sick, and it would not just go away after that one episode. And seizure. Do you use genetics to help with preventive? No, we're not doing that yet. That's the future, but it's coming. And it does exist in some very cutting-edge institutions across the country, but people do get their, what's it called, 23andMe, I think, the test where you do the swab in the mouth and you find out all of your genetic predispositions to certain things. And anybody who's seen one can tell you that it's really not all that useful for taking action on, because it gives you these percentages of likelihood of having such and such and such and such, and a lot of times you have multiple genes for this thing, and one will say, well, if you have this, you have a 60% chance for it. Another one will say, well, if you have this, you have a 30% chance for the same problem. different genes influence different things. So it's a whole lot of information with not a whole lot of practical use yet. Don't forget to watch the replay. Is the seizure possible to be isolated incident, or should I be more concerned? This one really needs to be going through your doctor, your personal seizure that you had. Talking in general terms about it, there's a workup that we would do in the office and possibly even refer to an endocrinologist because it's kind of beyond the scope of what we normally do here. A non-diabetic having a seizure due to hypoglycemia. It may be that you have very severe reactive hypoglycemia. Henry Bensi, thank you for joining us. When do you recommend getting a shingles vaccine? I recommend it when I am with a patient who hasn't had it, who has not had shingles, and they're over age 60. I recommend it strongly if their insurance will pay for it. I recommend it not as strongly if their insurance won't pay for it. Here's the reason. 1 in 4, 1 in 5 people will get shingles. If the shot costs $200 to $230, you're figuring we're spending about $1,000 for a case of shingles that we're preventing. So if the insurance covers it, yeah, get it. If it doesn't, are you going to pay? Would you personally pay $1,000 to avoid that? A lot of people would. I'll tell you, a lot of people have had the pain of shingles go on and on and on after they had the shingles, particularly people over age 50. They say they would pay $1,000 to not have experienced that. Now, why do I say $1,000? I explained it, but maybe it wasn't clear. $1,000 when it only costs $230, because you have to treat about 4 to 5 people, in order for one to benefit from the vaccine. What if you had the chickenpox vaccine? Do you worry about shingles? We don't have people who have the chickenpox vaccine who are old enough to get shingles, so it's not a question yet, and won't be for several decades, and I don't know that we have adequate answers even from the studies. There's probably suggestions. Gwen, do you know anything about chickenpox vaccine recipients getting shingles vaccine?
I don't think we have enough data.
He doesn't think we have enough data either.
Yeah.
Holly, thanks for coming back. We missed you while you were gone. Okay, we'll see you. You have a great afternoon. And actually, come to think of it, I got to go too. I've got patients. See one checking in right now. So, hey guys, thank you so much for joining. Those who haven't already, please swipe right and follow. Check out AskDrVaughan.com and MedicallySpeakingRadio.com. And we will, yes, you're welcome for the advice. Thank you. We'll catch you next time. Until next time, this is Dr. Mark Vaughan telling you to stay in good health.